Top Med Talk.
Good morning. We are here today at the Royal College of Anaesthetists inaugural meeting, Anesthesia 2018, at the beautiful British Museum here in London. And we are going to reflect a little bit on what we heard during our first session. I'm Desiree Chappell, your host of Top Med Talk. I have Monty Mythen, the editor-in-chief of Top Med Talk, and one of our co-hosts here, Joff, Lacey. And we're going to be just discussing what we heard this morning from the president of the Royal College of Anaesthetists, Dr. Liam Brennan, as well as Professor Paul Miles, who is Department of Anesthesia and Perioperative Medicine from Melbourne, Australia. So we had a great perspective, an international perspective really, on what's happening in anesthesia and perioperative medicine right now. And we also heard this morning, our keynote speaker, Professor Stephen Powis. He's the medical director of NHS England. He had some great perspective on what's happened in the NHS over the last 70 years. And so I kind of want to get your guys' perspective on what he talked about today. First of all, just for me, I loved hearing from Liam and Paul both about population health and public health and how perioperative medicine are addressing those. And Dr. Powis, or Professor Powis, went into that as well. And he talked about several different things that the NHS is doing as far as addressing those issues. And one of the great topics was talking about early prevention and talking about cancer. And yesterday, Monty, where did we go yesterday? We talked about, we went and stopped into the NHS.
So we were in the
Center?
University College Hospital Macmillan Cancer Centre. So it's our ambulatory cancer centre, which was open a number of years with a significant support from the Macmillan. It's a charitable organisation, but it's a national health service facility, free at point of use. The traditions of the NHS started 70 years ago, and I know, what were your reflections on it, Desiree? What did you think of the environment compared to what you're used to in the USA?
It was beautiful. It was actually very surprising that that is what is available to anyone at any time to care for them even when they're experiencing cancer. I mean, the technology, the innovation that was going on there, something that you don't see in the U.S. and in many places that I've been to and practiced in myself. So it was a unique experience to know that is services are being offered to everyone. I mean, it's not just anyone that can pay for it. It's to all of society here in the UK.
I think it was referred to in all the presentations that in the Commonwealth Fund evaluation, so all of the speakers reflected on this. The United Kingdom, the National Health Service, 70 years old, still sticking to those core principles, still comes out number one in all of the rankings. But it was brought up in the discussions that in terms of outcomes, it ranks number 10. Now, immediately some people jump on that and say, well, I'd rather be in a country where outcomes rank number one. But if you're going to look after the whole population as we do, everybody without, at point of use, it's an unrealistic expectation to come out at number one when you're looking after absolutely everyone, which we do.
No, I totally agree. I think if you've got a non-selective universal healthcare, you're up against the wall and particularly in a financially strapped healthcare system where budgets are being cut left, right, and centre. It becomes increasingly hard to kind of improve those outcomes to the degree where you compete with systems which don't have that kind of setup. I just wanted to say, though, on that, particularly Professor Powis, in the 70th anniversary of the NHS, he gave a great quote from a book about healthcare, the welfare state. And I think it's certainly someone reasonably early on in their career, it hit quite a point in which he said, since its inception, the NHS has been in financial crisis, and certainly for the last 65 years, the morale has universally never been lower. And I think that's something for us to definitely take stock and go, actually, there's lots of stuff in the media about how things are at the lowest and morale's shot. but actually, what we do is amazing, and the NHS is incredible, and the British public are as proud as punch that they are part of this system as well, and that I enjoyed that quite a lot.
And you still are leading healthcare in the world, even though you have some of those disparities and difficulties that we all deal with across the globe. So, that you still are innovative and have the resources and things that you guys do is.
Well, I was watching a presentation yesterday at the annual scientific meeting of the Royal College of Anaesthetists, and one of the presentations emphasised the fact that the health market in the UK, in the broadest sense, whether it's drug development, innovation, is the biggest financial contributor to our economy. So alongside the NHS is this huge, thriving, innovative industry, creating things that we might think might be unaffordable to the National Health Service, but if we innovate and adopt, they will become affordable.
Absolutely, yeah. I think we forget the beneficial the kind of windfall that goes with the NHS, and it's not just the healthcare it provides; it's the peripheral benefits as well. So,
yeah. One of the things that Professor Powis was also talking about was perioperative care and how an anesthetist can perpetuate that or make that part of the model of care, and integrating care as well. What were some of the takeaways that you had from that?
Well, I think the first two presentations, which were badged as perioperative medicine, which we'll come back to later in the day, I hope, with Liam, the president, and Professor Paul Miles, it very much then, Steve Powis emphasised that he's completely behind that. He's applauded the fact that we're getting up off the stool in the operating room in theatre, getting out there and engaging in this continuity of care. And if I go down, if you don't mind, Desiree,
yeah, please do.
I made a note of his top 10 priorities, and I was getting a sort of warm, fuzzy feeling that they align completely with the vision document for perioperative medicine. So he says, number one is improve outcomes and deal with the big killers. Whereas, cancer surgery, all those issues, we're all over that. Prevention, public health, so we're all recognising that's number two, that surgery represents a teachable moment. We've done lots on Top Med talk about that, fit for surgery, fit for life, all those things we can make a difference. Digital and artificial intelligence. So I was privileged yesterday to be interviewed by the Wall Street Journal about artificial intelligence being adopted for hemodynamic monitoring, launched in Europe a year ago. Fantastic. Genomics, I think for some of us older folks, we're still catching up with the language, but we're already seeing the recognition of genetic variation from the point of view of how people react to drugs. Innovation and fast-tracking innovation we've been great adopters, particularly of both the technologies and the drugs. Maybe at some stage we'll reflect on us being a little bit slow to willfully accept some of our fantastic technologies. Number 6 was integrated care. That's the perioperative medicine agenda. Number 7 was the workforce, which we've recognised and discussed repeatedly. We're going to have to diversify there. Number 8 was clinical leadership. That's what we're doing at the moment. Number 9 was continuous improvement, of which a lot of the examples were given were from Team Anaesthesia, the perioperative quality improvement programme. And number 10 was health inequalities. And I don't know, Joff, sorry to bang on about the 10, but
it's a very achievable list, isn't it? No, absolutely. I as you said, that warm fuzzy feeling that these align with the vision of the Royal College and the perioperative medicine movement. But it's a big list.
And health inequalities, Desiree, and we've talked about this a lot in our previous podcasts.
Yeah.
You've seen the NHS quite often now. We keep discussing about some of the huge health inequalities in the USA, for example. People pushed in, it was referred to in the talk, people pushed into poverty by the challenge of paying their medical bills. Do you think we should do everything possible to hang on to this NHS thing?
I think it's a great idea. I think more people need to adopt your models, and the top 10 ideas that Professor Powis had is something that all of us internationally can use. Health inequalities for us in the U.S. are huge. People are being bankrupted every day for having to pay for even minor medical problems, and it's creating more of that divide of socioeconomic inequality as well, and putting people into poverty. So I think probably would help to move that up a little bit higher on the list, actually.
Well, it's even in a system that has universal healthcare, such as England, in terms of healthy lives, there's huge inequality amongst different regions of the UK, where in terms of disease-free lives, some people are only having up to 40 years of a disease-free life in some parts of the country. So there's even in a universal system, we have large health inequality, and that makes it even more of a challenge, more of an important challenge to meet.
So if that's not, sorry to cut across, Desiree, but if that's not lack of access,
well, yes, exactly.
It must be the public health issues.
Yes, exactly.
Well, and it's really moving instead of intervention, education and upstream thinking of reaching the population before they hit the system and cause stress.
Yeah.
Well, it looks like we're going to be wrapping things up here. Any final thoughts on that first session?
Just that it was a fabulous landscaping session, looking at past, present, and future, and really, really enjoyable.
Scary quote that I got from that is that medical knowledge will soon be doubling every 73 days as opposed to every
50 years.
What did you say, 50 years?
I thought my head hurt already, but man.
All right. So during that first session, we did hear again from Professor Liam Brennan and Paul Miles. We are looking forward to talking to them later today on Top Med Talk about their perspectives and some other speakers today, Mark Edwards and Professor Gerard Danjou. So stay tuned to Top Med Talk for some of those future conversations. We're going to head back in. Thanks, guys.
Top Med Talk.